Welcome to week 9. We're going to go through a couple things here. We're going to first go through some PowerPoints. We'll go through the urinary system, the cardiovascular system, and we'll go through the in-class lecture, which is an extension of the cardiovascular system. And then we're going to go through some 3D imaging of the urinary system and the cardiovascular system. And then we'll look at the CAT scan images. Right? What do all of these look like on CT scan? And also remember that they're always, if you see ED puzzle on any of these course titles, that means it's an ED puzzle assignment. So if you just log into your ED puzzle, the link is here at the top. You will see the assignment there and the due date, right? It's got to go through and do it as per usual. Okay. So we will start with the PowerPoints, and these are still going to be available for you to look at on the week 9 right here. And I'll put the link for this video somewhere here as I'm talking in the future. All right. So let's go through, and we will start with the urinary system. And just a few slides on here because I want to save most of the time for the images on CT and 3D. All right, so I'll go through this in a nutshell. So the urinary system basically is responsible for excreting waste from your body, right? And so it cleans the blood. That's what the kidneys do. So one of the things that we do in CT imaging is that we test the patient's kidney functions before we give them contrast, IV contrast especially, because we want to make sure that your kidney function is reasonable enough to excrete the contrast without much fanfare, without much problems. And we look at what's called the glomerular filtration rate. What that is how well the blood is filtered through here. It's called a glomerulus. The blood is basically filtered through here. That's in the nephron, which is a functional unit of the kidney, right? So when you hear GFR, it stands for glomerular filtration rate, how well the kidneys are filtering the blood. And we want that value to be ideally greater than 60 is normal. And different institutions will have a different value for what they consider acceptable. Some will inject contrast with GFR values as low as 30. Some will inject IV contrast as low as 25. Just depends on where you are, right? But the important thing is we want to make sure that the kidneys are functioning well enough for us to give the patient IV contrast. All right. So what happens? Urine is created in the kidneys and sent to the bladder via the ureters and stored here until it's excreted via the urethra. Via the urethra. Now, some of the problems we can have with kidneys, or some of the indications why we might do a CT scan of the kidneys, is kidney stones or urinary calculi, or nephrolithiasis is another word that you will hear. So those terms are what you would commonly hear. Let me spell that word for you. Actually I can just put it up on the screen. Let me pull up a website and I'll pull it up on the screen. Nephrolithiasis, and that's what it looks like. It just means kidney stones. Fancy word for kidney stones. And so this is one reason people will have a CAT scan. They have this agonizing pain. Sometimes they would compare it to labor pains, because what's happening is that the stones, literal calcification, is making its way. It's formed in the kidney and making its way down the ureters, and it's scraping along the walls of the ureters and inside the kidney, and it's trying to make its way through. Sometimes it can pass. If any of you have had a kidney stone, you'll know it's a terrible, excruciating thing. And on its way down, it can scrape the walls of the urethra and cause what's called hematuria. Hematuria. Let me pull it up on the screen for you. Hematuria. Hematuria. That just means blood in the urine. So if you have visible blood in the urine, that's a serious problem. Also, you can have microscopic hematuria, where they would test your blood and then they would see that there's faint amounts of blood in your urine. And then a kidney stone would be the strong suspicion as to why that might be the case. Right, so that's kidney stones is one indication for a CT scan. So we can see it here on X-ray. Sometimes that X-ray isn't enough to tell you it's positive for you're positive for having a kidney stone, right? And this is a CT scan looking here. That's the liver. That's the right kidney. And we can see these white areas here. That's kidney stone. We haven't given contrast. Everything's homogeneous, and we can see these white areas here in the kidneys. That's a hallmark of kidney stones in the kidneys, right? And remember from earlier discussions that things show up as white if they are high in atomic number or high density or dense structures. So the bone is white, and so likewise the kidney stone is a dense structure made of calcium sometimes, and it shows up as white. So we don't need contrast for that. So typically if a patient shows up for CT scan for kidney stones, they don't give any type of contrast. Fortunately, there are machines now, which I think is an industry standard, that can do what's called virtual unenhanced CT scans. Virtual unenhanced CT. So we would give the patient a CT scan with contrast, and the machine will then subtract the contrast from the study, thereby giving us a non-contrast study, even though we inject it. All right, just a little tidbit for you. And then let's continue on. Let me bring this back up. Let me continue on to some other stuff. We can have ectopic or malrotated kidney. Ectopic just means something's out of place. You've heard of ectopic pregnancy, no doubt. So ectopic kidney stands to reason. It's a kidney that's not in the right place. It could be a serious problem, right? Or a malrotated kidney implies that it might be in the right place, but it's rotated, or it's not positioned properly. You can read this on your own time if you haven't already. I put some other wordings here for these slides. Interesting fact here. I'll skip that. You can read that on your own time. Pyelonephritis. Now, from earlier discussions where we talk about the suffix itis, by now you would have known that itis just means inflammation, right? So pyelonephritis, pyelo refers to the kidney, and so an inflammation of the kidney is what's happening here. So you can see the normal kidney over here on the left, and the pyelonephritis kidney over here on the right. There's a short video here you can watch, and the link is also here that talks about that. Renal cancer, or suspected renal cancer, is another reason why we can do a CT scan. Anywhere there's some type of tumor, they typically go for a CT scan, and one of the first things they do. They can also do nuclear medicine, but CT scan is one of the first imaging modalities used to diagnose a type of cancer, right? And you should know these terms. For example, Wilms tumor is a typical registry type question that would ask you, Wilms tumor impacts what kind of patients? And it would say childhood kidney cancer, right? So renal cell carcinoma is more common in adults. Wilms tumor is a childhood kidney cancer. Other congenital conditions, so renal agenesis, that just means there's a rare abnormality where only one kidney forms. Agenesis means a lack of growth of something. Something does not develop or something does not grow, right? Agenesis, only one kidney is formed. I actually saw a patient yesterday with 3 kidneys. Supernumerary kidney, that just means a condition where a small third kidney forms, right? So just remember that congenital just means something that you're born with. And the other thing we can have is a hypoplastic kidney, having one normal and one much smaller replica on the other side. So this is a normal sized kidney, and this is a replica of the other one, but it's smaller than normal. All right, so you've heard of TB. So most likely you know that TB is something that presents in the lungs. What you may or may not know is that you can have TB in your brain or TB in your kidneys. And you can see it right there. So tuberculosis of the kidneys, or renal TB, is a real thing. That's what it looks like on CT. Here we can see the liver again, colon. We can see the left kidney and the right kidney. Cystitis, here's a suffix again, itis. This means that there's inflammation. So we have a normal bladder here on the left and the inflamed bladder. You can see the redness there. And what's happening on CT is that the lining of the bladder will be deformed, right? So remember that the contrast is now inside, coming down the ureters into the bladder. So we're seeing the outline of the inner part of the bladder, much like here. So it's going to be deformed. This is a severe case of cystitis. And the last one we look at pertaining to the urinary system on this set of slides is polycystic kidney disease, or PKD. So there's no cure for this, and it's an inherited condition, and that which eventually results in renal impairment. So this is what it looks like a normal kidney here, and this is what it looks like with a PKD kidney. And over here you can see all kinds of things wrong. So if we look back on a normal kidney here, normal meaning does not have PKD. It has a kidney stone, but here's one that has PKD on CT. You can see it there. All right. And that's the short description of what these 13 slides are about. All right, now let's quickly move on to the heart, and then we'll go on to the blood vessels. And so I won't go through and read everything that's on here. Read it on your own time. We'll just talk about some important bits that you should know at this stage of your career and also for this course. All right, so you should know that the heart consists of chambers. There are 4 chambers here. There are 2 atria, 2 ventricles. The atria are receiving blood. The ventricles are pumping blood, right? And the left side of the heart handles oxygen-rich blood, and the right side of the heart handles oxygen-poor blood, or deoxygenated blood. Right? You might remember this from A&P. Right? So just remember there are 4 chambers, 2 atria, and 2 ventricles. The atria receive blood, the ventricles pump blood. You might have heard the word cyanosis. Bluish color of the skin literally caused by shortage of oxygen in the blood. Okay, so if you notice on every image, heart diagram, on almost every image or diagram, you would see veins show up as blue and arteries show up as red. So it stands to reason that if you're looking at a diagram of the heart, then this side that's blue is oxygen deprived or devoid of oxygen, or has less oxygen than the red side, which is oxygen rich. So your heart your blood isn't really blue. In reality, oxygen poor blood is darker, but it's not blue, right? And oxygen rich blood, it has a brighter, rich red color. That's how that works. All right, you should also know that there are 2 types of circulation. There's a video in Edpuzzle I put there. I didn't create the video, but I edited the video that talks about the 2 types of circulation. You should know this. One's systemic, one's pulmonary. Pulmonary has to do with the lungs, meaning blood is going to and from the lungs. And systemic circulation, you can see it here, means blood is going to and from the rest of the body. So you go into the lungs to get oxygen and get rid of carbon dioxide and so on. And it's returning back with oxygen. Then that's going to your body. That's systemic circulation. And there are valves here that kind of guide the blood through the heart and through your circulatory system. We'll talk about the differences between the veins and arteries in the next slide, but for the heart, you should know that there are valves that separate these chambers and the major blood vessels. For example, from the left atria to the left ventricle is a valve. Hence, on the same side, from the right atrium to the right ventricle, there's also a valve, right? And then from the left ventricle to what this is called the aorta, there's also a valve because the aortic semilunar valve. And then from the right ventricle to the pulmonary trunk, we call it a pulmonary semilunar valve, right? This is a left atrioventricular valve. Makes sense because left atrioventricular valve, right atrioventricular valve. Dig a little deeper. This is the mitral valve. And this is we just call this a right atrioventricular valve. But the mitral valve is important because that's the one that's most commonly replaced. And you can see that easily on X-ray if it's been replaced, right? So if we look at the mitral valve replacement, we can see that on, let me see if I could find an X-ray. Let's do X-ray. So X-ray first, and you can see it there on X-ray. And if we do it on CT, you can also see it on, let's use this one. Let's see if I find a nice one. Yeah, you can see it here on CT. This one, and you can see it on, I'm trying not to find one that's not, you can see it here too. Okay. And the reason why that valve is typically the first one to fail in your heart, well, the thickest part of the heart muscle is around this valve here, the left ventricle. That's because it's doing a lot of work pumping to the largest artery in the body, the aorta. And this is going to the rest of the body, so it has to do a lot of work. So this muscle is really thick, and this valve has to snap shut to prevent blood from going back from the ventricle to the atrium, to the left atrium. Sometimes if this valve is weakened by the constant pressure for a variety of reasons, it can fail. That's a problem because now you'll have all kinds of blood pressure problems and circulation problems, fluid buildup and so on. It's all possible, right? So this valve, the mitral valve, will fail most commonly than the others. Okay. It's important for you to know the muscle layers of the heart. I think that might be something that's in your content specifications. You might want to check that. Actually, I can check that for you now. And this is actually very, very important. ASRT content specifications. And you can just Google that to see what's on here. So if you look at, let's do control find and do cardiac respiratory arrest. Let's do heart. Okay, fortunate is not on the content specification. That doesn't mean it's not important to know it, right? Doesn't mean it's not important to know it, because there might be pilot questions. Regardless, we will talk about them briefly here. The layers of the heart muscle, which will be reviewed for most of you, if not all of you, right? So the heart, these layers are right here: the pericardium, epicardium, myocardium, and endocardium. All right, so when you hear the term cardium, that pertains to the heart. Now, why is this important? Well, they have a condition called pericarditis. That just means it's inflammation here. There's another one called pneumopericardium. You've heard of pneumothorax. That just means there's air trapped in the layers between the heart, right? And there's hemopericardium. That just means there's blood. This is why it's important to know what these terms mean. You can also have pericardial effusion. That just means there's fluid that's built up around the heart, and that's a problem because that can then limit your heart function, right? Let me spell these out for you. So the first one we spoke about was pneumopericardium, and I'll show you an image of that. That's what it looks like on X-ray. Let me pull it up on the right here, and that's what it looks like on CT. And the next one we spoke about was hemopericardium. It's hard to see on CT, on X-ray, so you gotta do something like this, because on X-ray you can just tell that the heart is enlarged, but on CT you can see that clearly here that they'll probably measure this Hounsfield number and tell you this is blood around the heart. It's not normal. And the other one we spoke about, pericarditis. Pericarditis. This means inflammation of the layers of around the heart, right? So if we can see this on CT, yes, we can. There you go. We can see it. There's all kinds of problems going on here, and it's very serious because then it can also impair cardiac function. All right. Okay. Continuing on with the heart, we got to look at the blood vessels that go to the heart. So we'll know that the heart is responsible for pumping blood to and from the lungs and to and from the body, but then it's also responsible for getting blood to the heart tissue itself. That's called coronary circulation or cardiac circulation, right? So it has its own arteries and veins, and the same diagrammatic references apply. If it's blue, it's veins. If it's red, it's artery. And so the coronary arteries, they originate, incidentally, at the root of the aorta, right here, at the ascending aorta. I'll show you that in a second. Just know that the heart needs its own blood supply, and it's called coronary circulation or cardiac circulation. And so if you hear someone has a heart attack or a blockage in their coronary artery, they're speaking of the blood vessels in their heart, which is a problem, because if the heart itself cannot get the nutrients it needs to function, that's when you can get a heart attack. One reason you can get a heart attack. All right, so typically heart valves, we can say that we talked about the names of them, but generally valves are to prevent backflow of blood. Right? We'll talk about the differences between the veins and the arteries in a second, but just know that valves are there to prevent the backflow of blood. That's all it is, right? And if you see bicuspid or tricuspid, the bicuspid just means it has two flaps, and tricuspid means it has three flaps. The mitral valve has two flaps. It's a bicuspid valve. Tricuspid valve is over here. This is the right atrioventricular valve. Okay. And the last slide here, we're talking briefly about how the heart maintains its rhythm. So you might have heard of a pacemaker. But what's happening is the rhythm makers of the heart, which would be the sinoatrial node and the atrioventricular node, sometimes they malfunction. So the heart does not beat at the right rhythm. And that can cause all kinds of problems if it's misfiring, right? It's a myriad of problems that you can develop if the heart is not beating at the right rhythm. So what they will do is sometimes insert a pacemaker, and it does what the name suggests. It maintains the right pace of the heart, and that's all that does. So they do an EKG and a battery of tests, and then they would tell, okay, your heart's not beating at the right rhythm, so we've got to put in a pacemaker to maintain that rhythm. And you can see that easily on CT and also on X-ray. I'm sure some of you have seen that so far in clinic. If you look up pacemaker, this is what it looks like in a 3D space right there. And let's look it up first on X-ray. And you can see it there on X-ray. Typically it's on the patient's left. And then on CT, you can see it there on CT. Now, what you can notice, the astute among you, is that these are streak artifacts. Streak artifacts because the pacemaker has metallic components. And so we'll get these streak artifacts that they kind of degrade the image, but we can still diagnose what's happening. The doctor can diagnose what's happening. This is well within the diagnostic range. Also, a lot of CT scanners now have what's called MAR, which is metallic artifact reduction, metallic artifact or removal or reduction, I think, depending on the machine, but we call it on GE metallic artifact reduction. And you can see the impact here on a set of scans that has not used that algorithm or that reformation. And the one on the right has it. So you can see there are less streak artifacts here on this one and more on the one that's not done with metallic artifact reduction algorithm. And sometimes that's necessary if the patient has unremovable metallic artifacts such as a pacemaker. All right, so in this short discussion, we talked about the valves of the heart, we talked about the chambers of the heart, we talked about the two types of circulation. That's also covered in this short video. We talk about the fact that the heart needs its own blood supply. So we call that the coronary circulation or cardiac circulation. And we talked about the role of pacemakers and what they look like on CT. Last PowerPoint we'll go through will be, we'll look at blood flow. And short, very, very short, just 6 slides here. Remember, this is an introductory class, so we won't go in depth with a lot of this stuff. But we'll go to the differences between veins and arteries, and in a little bit we'll look at some of these major vessels on CT, and we'll look at the heart and so on. But let's first talk about the differences between veins and arteries. Right, so we can see some of them here. Generally speaking, most arteries are rich in oxygen, and the opposite is true. So if I say something about the artery, it's the opposite for veins. Most arteries are rich in oxygen. Most arteries carry blood away from the heart to the body. So the opposite is true of veins, right? The most arteries do not have valves, and most arteries are deeper than veins. All right, so arteries are deeper than veins, and they generally don't have valves, and they're also thicker, and they generally carry blood away from the heart, and they also are rich in oxygen. That's arteries. So the opposite is true of veins. That's also covered in one of the videos on the ED puzzle. And some of those questions will show up in a different way in the quiz, by the way. All right, and so we could look again at a different diagram here. Why do we inject contrast? Well, contrast will help us to see the blood vessels. Without that, it will be hard to delineate which is which in some structures in the body. Right, so if you want to see, for example, the blood vessels in the liver, we want to inject contrast and we scan at different phases, right? And especially for the heart and the coronary circulation, someone's having a blocked vessel or narrowed blood vessels, right? We want to inject contrast to see how patent the blood vessels are. That's one of the reasons. So if we're going to start an IV on a patient, or intravenous access, we go for the veins. The technologist does not access arteries. That's something that the doctor will do under special circumstances. For us, when we're injecting contrast, we only inject in the vein as technologists, and it's our job to find the vein, insert the needle, start the IV, and inject the contrast. It's a huge responsibility, not to be taken lightly. And remember earlier I said that arteries are deeper. Well, it stands to reason that veins are more superficial, and this is why it's easier for us to access them. The back of the hand is not one that we prefer to get to. We try to get to this area here. We call it the antecubital space, because these are typically larger and more stable than the ones in the back of the hand. All right, so this is a reminder, we only as technologists inject contrast in veins. That's because veins, unlike arteries, are superficial. Arteries are deeper. There are some exceptions. So earlier I said that most arteries carry oxygenated blood, which stands to reason that most veins carry deoxygenated blood. There is at least one major exception that you should know about: the pulmonary artery and the pulmonary veins. So the pulmonary artery, well, it's called an artery because it's carrying blood away from the heart, but it does not have any oxygen, hence it's called a blue here. So it's coming from the right side of the heart, where in the previous PowerPoint we said that the right side of the heart has oxygen depleted blood. It's an artery, but it does not have oxygen. And the other exception to that is on the other side, where pulmonary vein, it's a vein, it's carrying blood from the body to the heart, but it is rich in oxygen because it's coming from the lungs. And that's the last part of pulmonary circulation, as its blood is returning from the lungs to the heart by the pulmonary veins. All right, so the exception to the rule about oxygen content, all veins, or most veins except the pulmonary artery, carry oxygen-rich blood. Most veins except the pulmonary vein carry oxygen-poor blood or deoxygenated blood. All right, here's some cool video links for you to open up. And we'll skip straight to some 3D imaging here. I'll skip this in a second. Here we go. All right, so let's start with the urinary system in a 3D space. We got the female here and the male. We can identify these really easy, right? We can see that's the kidney. And can you guess which ones are right, which ones are left? I'll give you a second. That's the right kidney, and it's lower. Why is it lower? I'll give you a second to answer that, or to think about it. It's lower because of the position of the liver. So the liver is on top of here. So the right kidney is lower than the left kidney, right? And so that's the kidneys, that's the ureters, that's the bladder, that's the urethra, right there. And that's the bladder, and those are the kidneys. Let's close that up. So it's going to be similar for the female, except now the urethra is shorter. Now let's try to look at this on CT before we get onto the cardiovascular system. Let's look at the CT, some CT images of the urinary system. And let's make this larger. Let's look at the axial images first. Just remember that axial imaging separates the body into superior and inferior sections. All right, so we can see right away that this has contrast, because we can see blood vessels that are lit up, right? And we can see the kidneys showing up right here. That's the left kidney, that's the right kidney. Notice how the left kidney starts before the right one as we scroll more inferior. That's not the right kidney, so that's the reason that the left kidney is going to finish before the right one, generally speaking. All right, so that's the kidneys, and that's the ureters right there. It's hard to follow sometimes. As a radiologist, it's easier for you to follow, but it's hard if you don't have the trained eyes. And that empties into the bladder right there. So even if we typed in, let's do ureters, let's do right ureter. We'll try to follow that. That's the right ureter. Let's try to follow it all the way down. The right ureter is now emptying into the bladder right there. All right, you can follow it all the way up. That's the right ureter. All you need to know at this stage is that these are the kidneys. They're lit up because we've given contrast. It's hard for us to follow the ureters as technologists unless you're staring at it. As long as you've done the right protocol, then your job is done. And this huge thing here is the bladder that is now filled with urine. All right. Point of fact, that's a prostate back here. Okay. So that is the bladder. That's the ureter. Let's try to look at this in some coronal imaging. Remember, coronal imaging separates the body into anterior and posterior sections. We can still see the left ureter right there. It's kind of hard to follow, but that's the left ureter. But we can see the kidney. That's the left one. That's the right one. Left renal sinus. We can see the left ureter. Let me see if we can follow this. It's going to be hard to follow all the way down to, actually no, here we go. So that's the left ureter still right there. Hard for you to follow. However, you should be able to identify the kidneys. So far, we've looked at the liver before, and now you can see the kidneys and the bladder. All right, that's the bladder right here, the prostate just inferior to that. That's the bladder and the kidneys. Cool. All right, so then let's look at the heart. We'll look at the cardiovascular system. And let me see if I can put some layers on here. All right, let's do that. And then let's take away some of this stuff. And we'll stick to the heart. Let's make this a little bit larger. And can we open this up? Let me see. No, we can't, but that's okay. But so this is, let's look at the top here. And this is, let's put back some more stuff. That's beautiful. Let's do that. So we've looked at a bunch of stuff, and this is the anterior, looking at it from the front. So that's the aorta, and that's the pulmonary trunk, or the pulmonary artery. Notice how that branches underneath the arch of the aorta. You can see it right there, right? That's the pulmonary trunk, and that's going from the heart, specifically from the right ventricle to the lungs to get oxygen, and that's the pulmonary veins coming back. And it's blue here because the pulmonary trunk or pulmonary artery, it does not have any oxygen. So let's find the cardiovascular arterial system, arteries of the thorax, and let's do pulmonary arteries. So there you go. Pulmonary trunk, pulmonary arteries are right there going to the lungs. And if we skip that and we go to, let's go to the pulmonary veins. Let's do the aorta instead. We can see the part of the aorta. That's the thoracic aorta, they call it. And that's the aortic arch right here. Aortic arch, thoracic aorta or descending aorta, that's the abdominal aorta. And these are the pulmonary veins. Those are emptying into the left atrium. All right, let's try to find some of this stuff on CT. Let's use a chest image, or chest stack of images. Let's use, let's use the axial images first. Let's do that. All right, maybe I should put, you know what I should do? I should put this side by side. Hopefully you're watching this on a tablet or a computer that's large enough. Let's put them side by side. Let's do that. Very, very good. Okay, so now we can see that's the aorta, the arch of the aorta, and that's the arch of the aorta here. This whole thing is the arch of the aorta, and that's coming out of the heart. So that's the ascending portion, that's the ascending portion, and that's coming out from the left ventricle, which is over here. So that's the left ventricle, right ventricle, interventricular septum. These are the pulmonary veins that's dumping into the left atrium. Pulmonary veins are here. Over here is the right atrium. All right, and that's receiving blood from the SVC and IVC. We can see the SVC here and the IVC here. Okay, important things, at least you should know the left ventricle, right ventricle, which you can see easily on any heart diagram, interventricular septum. You should know that this is the aortic arch, right? And you should know just inferior to that, like on this image, that's the pulmonary trunk. So this is superior, that's the aortic arch. Going down is now the pulmonary trunk. Pulmonary trunk, and that's the right and left pulmonary artery, as you can see here. All right, so let's continue on with some more images of, give me 1 second here. Some more images of that 3D images of the circulatory system. And then let me make this smaller again. So going up, I mentioned that this is the SVC, or superior vena cava, and that returns blood from everything above the heart. And the inferior vena cava, that stands to reason that it's returning blood from everything, every part of the body below the heart. But they're both dumping into the right atrium, right? So let's look at that on CT. Let's look at that on CT. Let me put them side by side. And if we look at, we can see the SVC. Don't worry about these right now. These are other blood vessels coming in. But this is the SVC. Just got to make sure you know that. This is a superior vena cava. And just below the heart, we can see the inferior vena cava. And that goes all the way through the liver, right? All the way through to the abdomen. Inferior vena cava, and splits in the pelvis. All right. And if we look at the major blood vessel here on the 3D image, we can see the arch of the aorta, which we just identified. That's the thoracic aorta and the abdominal aorta. Together we call that the descending, or the part that's going down from the arch, right? So you can, specifically, the doctors will say the thoracic aorta or the abdominal aorta. And one of the things that people would bring people in is they're having chest pain radiating down to the back, and they would have a suspicion of aneurysm, abdominal aortic aneurysm, or thoracic aortic aneurysm, or a thoracic dissection. Or aneurysm just means it's a blood vessel that is swollen beyond, threatening to swell beyond its limits, right? So AAA, you would call it, not AAA. CT, let's use that. Abdominal, oh my God, that's funny. I guess I have to say the abdominal aortic aneurysm. There's a bulge in the aorta. You can see it there. And on CT, so this is normal, the normal limits here on the aorta. On CT, you can see what that looks like. Let's put up a large image. Let me make this full screen. There you go. So you can see how large that aorta is, and it's a aneurysm, aortic aneurysm, which is different from dissection of the aorta, which means the wall itself has split. There are different classifications of these, but the wall itself has now split. So we have basically a false lumen and a true lumen. And it could be a serious problem, because now if that wall is too thin, it can rupture. It can be a huge, huge problem. All right? Excuse me. So that's a normal one. That's a small split. And now this is a dissection. Let's see if we can find some CT images to compare that. And here's an exaggerated one here. This is a pretty serious one. You can see that there's a definite split there in the aortic arch, right there. Pretty serious stuff. Let's exit full screen. Here, let's recap really quickly. We covered the urinary system. We covered the heart and its own circulation. We talked about some major blood vessels, mainly the aorta and SVC and IVC, right? So that's the aorta, arch of the aorta, it's the ascending aorta, and that's the descending aorta, or the thoracic aorta. Descending abdominal aorta is going to be down lower in the abdomen, as the name suggests. The IVC is what returns blood from everything below the heart to the heart. The SVC returns blood from everything above the heart down to the heart, right? And then we spoke about the pulmonary trunk, which is just inferior to the aortic arch. That's the pulmonary trunk, and that splits into the right and left pulmonary artery, as we saw on a 3D space. And then we continued down to look at we didn't talk about the blood vessels in the liver so much, but not so important. Just know that the liver receives a lot of blood. All right, and so we looked at the IVC here. You can see it all the way alongside the liver. It's important for you to know that the IVC is going to be shown to the left of the aorta on an axial image. As you're coming down to the abdominal aorta, It splits into common iliacs, right? And then that split, once it gets past the pelvis, it then splits into femoral arteries. Cool. So that's a lot of stuff we covered. You go back and watch the PowerPoints. You can rewind this video if you need to. And remember to do the ED puzzle questions. And I'll see you in class. Take it easy.